Well, hi there, Mander.
Hi, we're back.
We're back again.
Part 2.
This is part 2, the oops, we did it again version.
Part 2, Electric Boogaloo.
Yeah, part 2, Electric Boogaloo. We didn't mean to make this 2 parts.
So that's
we
why the
talked for a
lighting's
real
all
long
weird.
time.
That's
Yeah,
why the
lighting's all weird.
It's gonna be weird.
Yeah,
so
it wasn't the intention. This was meant to be like a quickie, so that did not happen.
we can
it's
bitch
fine,
a
it's
lot.
whatever. Yeah, I bitch a lot. So
Well, I wasn't gonna say anything, but you know.
Yeah, you're like, damn, Nikki, shut up. But yeah, so we're not going to talk at you really any longer. We're just going to let you watch it.
Mm-hmm.
So
we're just making this intro after the fact. So
yeah,
enjoy
we're
the
just making
weird.
this after the fact.
Enjoy the weird lighting.
Add
Enjoy the weird
some sort of transition into it.
You have a week to do
for
it.
part 2. Part 2 of the bitching continues.
The bitch-sode.
The bitch-sode, the comeback-sode, the Nikki has problems-sode, whatever you want to call it. All right. We love you. Enjoy. Yeah. I don't know. My shit's real depressing. I don't even know if I really want to get into all of it, honestly, because it's a lot.
You can just give like a general general idea of what happened.
Yeah. I basically just feel like everything's kind of been going to shit. I guess the most recent thing is like I've tried very hard to like relax these few weeks, and I on a good note, I finished Dreamlight Valley.
Mm-hmm.
And Jordan let me, I don't say let me, it sounds so bad, but I was able to get the DLC last night. So that's good. I'm very excited about that. I've started it, but I didn't get very far. So
you finished like the Beast and the Bell.
The main one. Yeah. Mm-hmm. Yep. I finished the main story. I finished up with Beast and Bell. And so now I'm on to the DLC, which is great. So I'm very happy about that. But I don't know. I've been really struggling mentally with everything that's going on with me health-wise, like physically, because I think so much has changed. And I think as autistic people, we do struggle with change. And I think I personally struggle with change more than I may even realize sometimes. And since March, it was such an abrupt life change. It was very abrupt. And like the lead up to that wasn't abrupt. Like I've mentioned this before. Like I'd been not feeling well for months, but I was just pushing through, and then I was forced to stop very abruptly. So life was just changed very abruptly for me. And I am also a delayed processor. So like my initial reaction to bad things happening
doesn't hit you right away.
Yeah, the initial reaction isn't always the one that sticks, right? So like I think in this circumstance, because it was so abrupt and because I was so terrified, my initial reaction was, it is what it is. Like, I just got to deal with it. Just fucking keep going and move on and whatever. Like, I was very nonchalant about it and tried to, like, slap this toxic positivity over it, right? And, like, I was trying my best to find the good in it before I ever even processed the rest of it and the reality and the gravity of everything that this meant for me. And I think now from March to June, which is what, April, May, June, 3 months, right? I've been able to finally like come to terms with it emotionally.
Really like stew in it.
Yeah, like just how life-changing and sad and hard this shit is for me. This illness is. and for it to not even really have a name yet and just really just be speculative at this point, because that's really what it is. It's just speculative.
Because I feel like if you knew like why this is happening, I feel like it would be better, because it's like, okay, well, at least if I know something's happening, like why something is happening,
right?
It's like, even if it's like something that's not necessarily like, like, so, like it's not like cancer, but like say something like, it's like, well, at least I know that it's this particular disease or this particular syndrome or this particular whatever. I know,
right.
at least I know what it is. We can then tackle it. But it's like, the fact is,
right.
like you guys are like, you're treating symptoms, but you don't know what's causing them.
Correct. So, and my therapist said it really well yesterday when I was in her office. It's like, she said, you almost have too many cooks in the kitchen with all these all the specialists that you see. My pulmonologist that I went to go see, which I didn't even really want to see anyway. I don't have problems with my shortness of breath and shit is not caused by a actual structural problem with my fucking lungs. Like, everything's fine. I had an esophagram. I have no hiatal hernias. I have a chest x-ray. There's no obstructions. There's no fluid in my lungs. Like, everything's physically anatomically fine. Like, I don't have any problems, but like, when it was good to know, but like, because all he did was look at my labs and didn't bother to like really ask much more than that, he had never met me before, the man looked at me and said, well, you're a relatively healthy person, so I mean, I don't think there's really anything to worry about.
It's like, that's not what I'm here, though.
I said, did you read my chart at all? Well, I mean, I'm just going based off your labs. You have better labs than I do. And I said, okay. Like, it's so bad, I don't even have the energy to argue with the doctors anymore. Because, like, I knew I was never going back to his office. So, like, what's the fucking point?
Right.
Nothing structurally is wrong with my lungs. I have no obstructions. I have no issues. I have no issues with my esophagus. We're good. I'm good. I'm not arguing with you if I don't have time. If it doesn't fucking matter, right? Like, if it doesn't matter, if I'm never going to see you again, I don't have time to even explain to you what is actually happening to me, because we would be here for 12 hours. Right? But it was fucking insulting. It's like, how do you know I'm a relatively fucking healthy person just because you looked at my blood work?
Right.
That's been my whole fucking life. Your labs are fine, so you're fine. Your labs are fine, so you're fine.
It's like, ask any chronically ill person. Like, a lot of times they're like, the whole, we don't look unhealthy. You don't look like, or when people like, say my mom has a handicap sticker, which they don't just hand out. They don't like,
no,
you don't just apply for it and you just get one, right? You have to have it from a doctor. And so
right.
like, and I don't know if she's personally ever had people say, she's older, so I don't think people were less likely, but if she was like, my age, like if I had her conditions and I had a handicap thing, I bet there'd be people like, we don't look like, why are you using that? You don't look unhealthy. You don't look
right.
you don't look disabled. It's like,
right.
it's so same thing like chronically ill people. Like, yeah, their blood, they can have perfect blood work, but that doesn't, like, people in chronic pain, like, that doesn't negate the fact that they're constantly in pain or constantly fatigued or constantly sick. Yes, they might have perfect potassium levels, perfect iron levels, perfect whatever, but that doesn't say, like, yes, it says some things, but that's not the whole picture.
Right.
That's like the cover of the book. That's not the synopsis.
Right.
That's not everything,
Yeah, and it only checks like a basic blood panel only checks for certain things. There's a lot of things that you won't even find. Like, a lot of these tests that you're looking for chronic illness have to be specifically requested, and some of them have multiple ways they can be ran. And if you don't run them the specific way that they need to be ran, you'll get a false negative.
Yeah, like,
so
like most times when you do your blood work, they do like 1 or 2 vials because they're just looking for certain things. But the blood can only go so far. Like, you can only run so many tests on 1 vial of blood. Where, like, when I had my stomach surgery, they had to take 14 vials of blood for the various tests that they had to do. So it's like, usually when you go do a regular blood panel, they take like 1 or 2 vials, depending on what they're doing, like what they're looking for. But like you said, whenever they're needing to look for something specific, they have to do either a specific test or run your blood through a specific machine, specific whatever.
Right.
So, like I said, like my surgery, I had to have 14 vials. And that was the most I ever had. So it's like obviously they're
Yeah.
checking for a lot because they're doing a
Right.
certain surgery, but they can't check for everything. This
Right.
isn't Theranos where you do one drop of blood and they check
Right.
for everything.
Right. So, I mean, I guess my biggest bitch in all of this is like, I'm just tired. I'm getting to the point where I don't want to say I'm tired of fighting because that's not true. I mean, it is, but it isn't. I want to feel better, but I'm
Like
tired of having to constantly fight these people
you're tired of arguing.
who
You're not
listen
tired of
to me.
fighting for
Yes, I'm
yourself.
tired of
Like
arguing.
you're tired of arguing.
Yes,
you're not giving up on like you're like you. I want to get better. It's not like you're like, well, I'm never gonna go to any doctors ever
right,
because none of them listen to me. Might as well just not
right,
try. It's more like the doctors I currently have aren't listening to me, so I'm just tired of arguing with
right,
them, and they can just say whatever.
right. I'm tired of being told by people with a medical degree. Now, not my general practitioner. We still love her. She's still listening. It's not who I'm talking about.
We stand
Like,
her, as the
we
kids
stand
say.
her. We stand Dr. Mayberry. Okay, it's not. I'm not talking about Dr. Mayberry, but it's mostly these specialists that I've been going to see. And sorry, I'm lispy because they just changed my wire on my braces, and it's a
I must be all the
different
time, so
one.
it's okay.
It's a different one now, and it's stronger, and they're moving my teeth a lot. But anyway, I'm sick and tired of someone with a medical degree thinking they know more about my personal body that I live in every single fucking day just because they went to medical school for an organ that I happen to have in it, right? Like, just because, like, my neurologist, for example, the thing I was going to tell you, my condition, what I was diagnosed with when I went to the hospital the first time, is called idiopathic, meaning they don't fucking know why, right? Intracranial, meaning in my fucking brain. Hypertension, meaning too much pressure in the brain, okay? Too much pressure in the brain that they have zero fucking explanation for, okay? Which, first of all, is a fucking cop out, if you ask me. And my nurse friend agrees that anything with idiopathic in front of it just means no one has taken the time to dig deeper and figure out what the fuck and why this is happening to somebody, right?
Mm-hmm.
Okay. Basically, what's happening to me is the spinal fluid that goes and goes through your spine and up your neck and around your brain that cushions the squish ball between your ears and all the nice little things in your spine from getting hurt, right? Cushions it. It's not reabsorbing properly when it gets up here to the brain. Okay? Nothing's blocked. All the MRI and the MRV has shown everything is flowing like it should. Okay? It's flowing everywhere it's supposed to flow. But it's getting stuck in here. It's not going back through my system and getting reabsorbed into my bloodstream and then being recirculated like it's supposed to. Okay?
It's almost like ground that's been like rained on too much and then floods, and so it doesn't have anywhere to
Right.
go.
Exactly. It's a great analogy. Thank you for that. It has nowhere to go once it gets here. It's supposed to have somewhere to go. It's supposed to be reabsorbed in a certain part of your brain and then get recirculated. Okay? It's not doing that for some reason. So it's just building and building and building. Well, what happens when it builds and builds and builds is it pushes on your brain and it squeezes it and it squishes it. Okay? That causes a whole manner of fucking problems. But for me personally, I turn into a shell of a fucking human who's depressed as fuck, exhausted, sometimes can't move, sometimes can't get out of bed to shower, have to force myself, and you know me, I love showering. Showering's my thing. You know that. It's my favorite. I went 4 days without a shower.
That's a lot. She showers every day.
4 fucking days. I would shower twice a day. If I fucking, thought that I had the spoons for it. I love a shower. A shower helps me decompress. When I do nothing else, I at least want a fucking shower. I went 4 fucking days without a shower. Now, I took some micellar water that I used to clean my face and I did my pits and my bits. Okay. I did the important bits, but I did not get in a shower for 4 fucking days straight. That is unheard of. I have had zero fucking appetite. Also unheard of. You know, a bitch will kill somebody when she's hungry.
She goes
I
from 0
will
to
cut a
60.
bitch.
As soon as she gets a hunger
Oh,
pain, she's like, she is a feisty bitch.
oh my god, I get the worst hangry. I mean, I am somebody's pure fucking nightmare if I am hangry, okay? When I tell you it's been a good 2 weeks since I remember having a thought about wanting to eat food. When they drained my spinal fluid yesterday, or not yesterday, day before, or was it yesterday?
Well, you came back yesterday at 1:30 a.m.
That's right. So it'd have been the day before. It'd have been Monday. I It took me till yesterday evening around 5:30 was my first thought of, ooh, I feel like noodles sound good. But I still wasn't actually physically hungry. I still had no physical hunger cues, but I had at least a thought that, oh, that kind of sounds good. But it's not like I was hungry or starving. There's days that today, I've only eaten one thing and I wasn't even eating it. I drank a smoothie out of a normal size solo cup. That is all that has entered my body today, other than a Dunkin' coffee. I've had no food. And I'm not hungry now. I could go the rest of the night not eating anything and just drinking water and be fine.
And I've been hungry all day.
But I am not like that. You know that.
Mhm.
Like, I'm not like that. I don't have that issue. I am always fucking hungry. If there's ever a mood that I am always in, it's fucking hungry, right?
Mhm.
Like, I will never say no to food and I could care less about it. So it's almost like being on Vyvanse all day, but I haven't touched my Vyvanse in months because it's causing my heart to do weird shit with all the other issues I'm having right now. So it's like I've been on Vyvanse for the last 2 weeks, but it's all fucking day, every day.
Mhm.
Zero fucking hunger cues. I am not well. I am not okay. Like, I'm not okay physically and I'm not okay mentally. And I am sick and fucking tired of people telling me that just because I'm 33 years old and a fat woman, that I'm going to be fine. I just need to lose some weight. Okay? So I have this conversation with this fucking neurologist yesterday about me going to the hospital because I was supposed to follow up. Okay? His nurse calls me back and is like, asked what happened, calls me and asks me what happened. I told her everything that happened. I'm also concerned that I'm allergic to the medication that he's put me on that's supposed to make this spinal fluid not build back up so quickly. Okay? Because I don't know if you can kind of see, it's probably kind of hard, but
It
I
looks
have a
red.
red rash. Yeah.
Mhm.
I have a red ass rash all on my fucking neck now because he upped my medicine again on Friday, the Friday prior. So last Friday. And by Saturday night, or by Saturday morning, I'm sorry, I woke up with this on my neck. And now I've been itching since I started this, but my body also itches for no fucking reason. So I just didn't really think anything of it because I'm always fucking itching for some reason, right? Because hello, mast cell activation. It could be 2 degrees too hot outside and my body be like, fuck you, rash time. You know what I mean? So like, it was whatever. I was just like, whatever. But then as soon as he upped it, and then within the morning I had a new fucking rash, I'm like, oh, that makes sense. It's a fucking medicine, right? So I told her this. She calls me back a couple hours later, says she talked to the doctor. She told him everything, including the fact that I'm broken out. And he tells her that he still wants to up my medication one more time to now 2,000 milligrams a day. So I'd be taking 4 pills in the morning and 4 pills at night. Okay.
So what's the point of doctors asking if you're allergic to any medications when they're just going to give you the medication you're obviously allergic to?
And then continue to up your dose of it, right?
Mm-hmm.
But that's not even the best part. then offers me, she says, or what we could do is give you a medication for migraines that might help your IIH issues, which I was already told the first time I met the man that would not help me. Or we can just keep you where you're at and he can see you earlier and you can discuss it with him then. And I said, can you just do me a favor? Because I wasn't going to be ignorant to the nurse. She's wonderful. I love her. It's not her fucking fault. She has to tell me what the doctor said.
Don't shoot
I'm
the
not
messenger,
shooting the messenger.
Yeah.
Right. I'm not. It ain't her fault. I'm not going to shoot the messenger. I said, could you do me a favor and just please remind him that I've already told you that I'm worried that I'm allergic to this. The reason I'm worried is that the even upping the medication, even if I wasn't allergic to it, isn't going to help me, is because the last time I had a lumbar puncture, when I was completely unmedicated for this because we didn't know I had it, the numbers that I got off that lumbar puncture and the numbers that I just had 6 weeks later after being on medication for 6 fucking weeks, then I had to have another lumbar puncture in the ER because I couldn't fucking function anymore, were essentially the same. And they drained off essentially the same amount of fluid this time as they did last time. Except for this time, I've been medicated for 6 weeks. So I'm concerned the medicine isn't working at all. So why would you continue to up it? Right? So she's like, okay, hang on. I'll just go talk to him real quick. He sends her back to me and you could tell in her voice she did not want to say this, but says to me, well, the doctor looked at your numbers, and since the two are pretty similar, he would consider your condition to be stable. So I think we just need to make the appointment for July 1st, and you can talk more about it with him then about what you want to do. Again, you could tell she did not want to tell me this. You could tell that was a bullshit fucking answer.
Also, stable doesn't mean good, because like when you hear like on TV shows and stuff, they're like, oh, he's stable. But that also means like they could be in a coma, they're not like bleeding to death. It's like they're stable, right. They're not going to die right away. So basically stable does not necessarily mean good. Like
the scream that I scrumped when I hung up that phone. Are you motherfucking kidding me? You mean to tell me that my condition that put me in the fucking hospital twice now.
In 6 weeks.
In 6 fucking weeks. Once medicated for 6 fucking weeks. Is considered fucking stable, all because my optic nerve isn't fucking damaged? And that's all you care about? That's all you fucking care about is the fact that my eyeballs are fine, so I must be fine? Fuck you. I can't function. And the medicine that I'm fucking allergic to that you keep dumping on me higher and higher doses makes it harder to fucking function. I don't know if this motherfucker's ever had his brain squished by his own fucking spinal fluid before, but here's a fucking newsflash for you, homeboy. It makes it real goddamn hard to do literally fucking anything.
Imagine that, like when your brain's in trauma the whole time, it makes it hard to do things.
Yes. Your brain and your fucking body is freaking the fuck out. But you still have to live a normal fucking life as a wife and a mother of 2 fucking kids and somehow figure out how to do that while also somehow figuring out how to get out of the fucking bed every single goddamn day and just function. Sometimes it's hard to fucking breathe when it's bad. That's not even a joke. There are days that I get out of my bed. You know where my bed is in relativity to my bathroom door. That's my bathroom door behind me. My bed is literally directly to this direction, left, not even 4 feet from me sitting in this chair. I would get from my bed to that fucking bathroom and not be able to fucking breathe. That is not a fucking joke. I am not fucking exaggerating. So obviously, the thing between my fucking ear holes that governs what the rest of this meat suit does is in fucking trauma. And is making it difficult for me to be a fucking person who lives and literally breathes. So, fuck you and the horse you rode on sideways. Because how do you fucking consider that to be fucking stable? How do you consider that any kind of fucking quality of life? All because my eyeballs are fucking fine and I'm not blind.
I also just don't understand. I also just don't understand his logic. He's like, okay, well, here was your levels, whatever levels they were measuring, when you were unmedicated, and we did this. Here's 6 weeks of being medicated. The levels are the same, about the same. That's
Right.
like someone going like say someone's like passing out, whatever. They're like, oh, you have low iron. That's why you're passing out. So we're gonna do 6 weeks of iron infusions. But then you're still passing out. And so then they're like, but your iron levels are the same. We might as well just up your doses of iron. Not realizing like, oh, it might be something else that's causing this. Like,
right.
you like say you're my bad. Like, say you're passing out, and they attribute it to be like low iron. Like, say it's like, oh, it's your iron levels. We'll give you 6 weeks of iron infusions, like heavy doses of iron. And it's like, oh, but you're still passing out, but your iron levels are the same. But I mean, you're not like, you're not stopping breathing while you're passing out. So
Right.
we'll just up the iron,
So
even though that
we're
makes you
not going to
sick.
think about why you're not absorbing all that fucking iron that we're infusing into your body, which is the quickest way to absorb the fucking iron.
Right.
Right? Clearly you have an iron absorption problem, but they're not going to worry about that. They're just worried about the fact that you didn't hit your head when you passed out. So it's not that bad. Right? That's basically what he tells me. So then this motherfucker calls me today. Personally, this time, because I called Dr. Mayberry's office and lost my shit. I said, I am never going back to this fucking neurologist again. He literally had the balls to tell his nurse to tell me that my condition is stable when I've been hospitalized twice now. I said, I'm done. I'm never seeing him again. Find me a new fucking neurologist because I'm done. And this motherfucker calls me personally today, and I'm pretty sure she called and ripped him a new asshole. Like, because they don't usually take time out of their day to call you.
Yeah, not
So,
neurologists.
like,
At least,
no. I'm pretty sure she called his office and told him what the fuck was up. So, he calls me personally today. He's like, hey, it's Capuch. I'm just wondering if, his name is stupid. Just wondering if, just heard you were really upset and nervous. Like, I just want to talk to you and figure out what's going on. Like, figure out what the symptoms are. Can you tell me more about this rash you're having? And It was real cool. So I told him, I said, but here's the problem. He's like, well, I looked at your eye exams, both of them, and it looks like your pressures in your nerve actually look better now. So like the acetazolamide is doing what it's supposed to be doing. I said, no, it's not. And I'm going to tell you why. Because you told me this medication is not only supposed to protect my eyes, but it's also supposed to reduce the amount of fluid that is building up in my body. Except for I've had 2 lumbar punctures 6 weeks away from each other that were essentially the same as far as pressure and how many fluids of how many cc's of fluid they had to pull off my fucking spine. So let me tell you why I ended up in the ER. Because when this happens to me, I can physically tell that my pressures are back up because I have migraines. I have problems walking. I get short of breath. I cry for no fucking reason. I sometimes don't want to move at all. Sometimes I can't move at all. I get shaky. I fall down. I have all these issues. I said, and I feel like there's no point in fucking even being alive anymore because I feel like a shell of a human. I said, so that is why I took myself to the ER because I was not okay. And I knew something was wrong. And as soon as they drain that stuff off my back, I feel like a brand new human. So I'm telling you, I don't give a shit about my eyes right now because I know I'm not going blind. I've had a doctor tell me twice my eyes are fine and I can see perfectly fine. And the aura and shit that I'm having is because the brain getting squished was causing me to have the migraine, which does screw with your eyes when you
Like,
have
he wants
one.
to treat all these symptoms, but not like the core Like, it's all of these are being caused because of brain pressure. It's like depression,
Correct.
the shortness of breath. Like, everything obviously is being controlled by the brain. So if something's fucking with the
Right.
brain, you gotta treat why whatever the fucking is happening. You gotta treat that. You gotta treat the fucking, not the
I said, I don't care. I literally said to him, I don't care about my eyes. I can't live like this anymore. And he says to me, well, you know, the only options that are left are not good options. It's either medication that doesn't work as well as the one you're on and isn't really made to deal with this, or you're talking about a shunt. And I said, yeah, I am. I'm talking about a shunt. He's like, well, you understand that's a surgery.
Yeah, because these shunts like for hearts and stuff, like whenever.
Yeah. He's like, you understand that's brain surgery, right? I said, yes, I do. I said, but here's the thing. Here's what I'm not going to do. Is go every 6 weeks for a lumbar puncture, because that is not a life. He has never had to have a needle that is 1.5 feet long shoved in his freaking back while you're perfectly awake while this is happening the entire time. Take the risk of this person hitting a nerve and paralyzing you because it's going in your freaking spinal column. If you've never had a kid and you never had an epidural, it's literally just like the epidural needles that they use. And sometimes the needle has to be bigger and smaller depending on what they're doing. So the gauge of the needle changes depending on what they're doing. And you have to have this shoved in your spine, in between your vertebrae, and lay there still the entire time, because if you cough or move and that needle slips, it goes in a nerve, you're fucking paralyzed. That's scary as shit. And I've had to have 2 of those now. I am not doing this shit every fucking 6 weeks. I'm not turning into a zombie every fucking 6 weeks and then going to have a fucking needle this long shoved in my back to have fluid drained off of my fucking body just because you don't want to refer me to a fucking neurosurgeon because you can't continue to medicate me and then you lose me as a fucking patient. Refer me to the fucking neurosurgeon and let me talk to him and let him tell me what the risk factors are. Let him talk to me about the fucking surgery because you don't know, because you don't fucking do them. He's not a fucking neurosurgeon. So he can tell me all damn day long that it's not a good option, but you don't even fucking do the surgeries, so your fucking opinion means shit to me. Refer me to somebody who can give me a fucking educated opinion then. Because yours I don't fucking care about. Like, I'm done doing this with him. And when I go to his fucking office on July 1st, he's going to hear everything I just fucking said to him.
It's like, I almost wonder, it's like, are you getting some sort of kickback from the pharmaceutical company that owns this medication? Like,
maybe.
Like, why this?
Or maybe he's just trying to keep his patients, so that, you got to think, the more patients you have, the more money you're making, right? So if he loses a patient, he's losing money. But guess what? I don't give a fuck, because this is my life. I don't care about your fucking paycheck. There will be another patient you can have. I care about my quality of fucking life. I am 33 years old. I have 2 children and a husband and a life that I'd like to fucking live. I don't care about your paycheck, buddy. I want my fucking life back. I'm tired of living like this. This is not a goddamn life. This is not a life. Turning into a vegetable between 4 and 6 weeks of time frame between having fluid drained off your back and then having to go do it all over again and then recover from it. Like, it's not a life. I don't want to keep doing this, and I won't. So if they have to cut my fucking brain open and put a tube in it and shunt this fluid to my stomach so that I can stop having to do this all the time, then that's what the fuck I'm gonna do. Whether that means brain surgery and a ridiculously hard recovery or not, I don't care. Because you know what? It's harder than having to recover from a surgery that's going to give me my life back? Living every fucking day like this. This is harder than having a fucking surgery.
I feel like that's also like less risk in the long term than, like you said, doing a lumbar puncture every 6 weeks, where every single one is a chance of so many complications.
Right. They dust over it like, oh, it's not that big of a deal. Fuck you. You hit one nerve wrong. You miss one thing. You do one tiny thing wrong during that, and you are done. You could be fucking paralyzed.
Because even when people do like normal blood draws, like, or donate blood or whatever, like in your arm. Like if you hit even one of those nerves wrong, you can like lose feeling in that arm
Yeah,
for the rest of your life. So it's like
exactly.
your spine, that's obviously a big deal.
Anytime you're sticking a needle anywhere in your body, you are running the risk of something going wrong. You know, like, I'm not going to keep doing this. And it hurts, guys. It doesn't feel good. The lidocaine that they use to numb you only goes so far. Like, once they get past where they topically fucking numb you, you still got to keep going. The needle got to go deeper than the lidocaine gets. So guess what? You get to feel it all the way through. And it's a fun feeling, let me fucking tell you. And then they got to flick it every once in a while too, so you get to feel them flick it. And when they flick it and they hit those nerves, your leg goes kicking and shit. Like, it's not fun. It's not fun. This is not a life. So I'm tired of these doctors telling me what I should do with my fucking life when you don't live it and you're not in my body. Because I guarantee you, if he had to live 3 fucking days in the pain and suffering that I fucking lived in before I took myself to the fucking hospital, he'd already had me at a neurosurgeon. And I'm going to say that to him. I understand that you don't have to live like this. But if you were in my body for 3 fucking days, you wouldn't make it. You would be at the fucking neurosurgeon already. And I'm sorry that might not fucking register to you, but I am not lying to you here.
He's not empathetic, so.
These people, it's not like I'm lining up to try to get a fucking brain. Nobody wants to just electively have a fucking brain surgery, buddy. Because there's plenty of complications and shit that can go wrong with that too. It's your fucking brain. You don't think I understand what's at risk with that? Because I fucking do. And if there's anything that I thought we could do to avoid that, you're fucking right, I'd do it. But at this point, it's clear that I can't take the medication that helps fix the fucking problem. And the alternative is getting a needle stuck in my back every fucking 4 to 6 weeks. And I'm not doing that. So that only option left is the shunt. What do you want me to do?
Especially because it seems like he's, like you said, he's not willing to look at other solutions. To him, it's either, well, you either take this medication or you have brain surgery. It's like, well, I feel like there's probably a few more options than that. Like
there really, honestly, there really isn't. I mean, I've looked myself. There really isn't. I mean, that it is what it is. Like, there really is only one medication that properly treats this, and it's the one that I'm fucking allergic to. So, like,
but they don't know what's wrong. They don't know why it's happening.
Exactly.
Like
and that's another thing. How do we know that it's not? Exactly. How do they know that it's not, that it's actually IIH, not hydrocephalus? Granted, the shunt treats both, so that would be great. But
yeah, I have a friend with hydrocephalus.
Like, how do they know what it actually is? I need a second opinion all the way around. I want someone to go back through my fucking MRI and my MRV and look at all the things that they marked that were congenital issues, like the fucking vein that's super narrow that you can't even see. Maybe that's part of the reason why all this shit's happening. There's other like things. There's I know you can go in and cauterize things so you can make less you end up creating less fluid by cauterizing certain things in your brain. So it's like, there's other things you can do. The shunt will be helpful, but there's also other parts of surgeries you can do. It's all surgeries, but like, there also needs to be a reason why this is happening, and we got to figure out why it's happening, and nobody really gives a shit to do that part. So I want to talk to somebody who fucking cares enough to try to help me figure out why the fuck this is happening. Pour back over that fucking MRI and really look at it and tell me, are we fucking missing anything here?
Because I guess because obviously it's like I never even took an anatomy class, but it's like, so when it's creating the fluid, it's nothing's blocking anything. Like the inner workings is fine. It just once it gets up to your brain, where does it cycle back down? It just kind of like cycles back and forth between the spine and the brain.
So I forget exactly if I want to say it's the cavernous sinuses. It's the inner part of your brain. It's on the inside. Like, if you look up hydrocephalus, let me pull it up real quick.
So actually, I have a friend who's autistic and has ADHD, and she is hydrocephalus, like diagnosed with it. So I actually kind of know what it is.
if you look at the brain here, oh, this is the one I like, the Mayo Clinic one. Let me send this to you. I'm going to send it to you in Messenger.
Okay.
It gives a really good picture of like what that looks like.
Because it's like I said, I've never really thought about spinal fluid, so I don't know. Like, okay, like I know
Yeah.
it's a thing. It like helps protect stuff and all
Yeah.
that.
And I'll drop this in the comments. I'll drop this link in the show notes as well. Let me find the picture again. The picture was in the, there it is. Okay, so it's in the ventricles. So it floats in it, and there's large openings called ventricles. They lie deep inside your brain, and the fluid-filled ventricles help keep it buoyant and cushioned. Let's see. It's caused when the fluid is produced and how much of it is reabsorbed back into the brain. Like there's an imbalance between that. And I believe that, let me see if I want to see where it goes into. I could have swore it's your, I'll call it your cavernous sinuses, your venous sinuses. So there's a place that it's supposed to be reabsorbed in your brain. There's a spot in your brain that reabsorbs it when it gets to where it needs to go. And for whatever reason, what they think is my brain's not reabsorbing it. So like they're saying nothing's blocked because I also have that cerebellar ectopia, which means at the base of my skull, you have your cerebellum, right? But there's parts of your cerebellum. So the very base of your skull, what is there as far as brain anatomy goes is something called your cerebellar tonsils. So it's not like your tonsils in your throat, but it's cerebellar, so like a part of your brain, the tonsils. It's supposed to stop. If you're watching on Patreon, you can see it's supposed to stop right at that little bit of the base of your skull. I think it's called the foramen. Like the divot. It's supposed to stop there. The part that dips down and makes that little
before your neck.
Last little curve for your neck, right? Exactly. Right before your cervical, the top first cervical vertebrae connects to your skull. Okay. It's supposed to stop there. And it's a congenital birth defect. And what happens is either your bones didn't fuse properly or quick enough. And so your brain, that bone either bent out or allowed, because it wasn't perfectly set, it allowed your cerebellar tonsils to grow under and behind, like outside of the skull. So they're outside of my skull, like dangling like out of the bottom of my skull, essentially. So if you look it up, you'll see something probably called a Chiari malformation. That's what's most known. But they said, again, the neurologist said it's not considered mine is not considered a Chiari because it's not drastic enough. Again, kind of hard believing anything he's fucking saying. It could be true. I don't know. Either way, they're sticking out of my fucking skull and they shouldn't be. Okay. So that causes problems with pushing on your spinal cord, moving your nerves around there. Another thing is when your brain is getting pushed on and then you have cerebellar ectopia with your brain sticking out the bottom of your skull, it's going to push that farther out. And it's going to push harder on all of that, which is why I have abnormal symptoms when it comes to what they're normally looking for with IIH. So I tell me, well, you can't be short of breath because that doesn't happen with people with IIH. Well, it does happen when it's pushing on your fucking spinal column and pushing everything down. What happens is when that happens, it'll push on the dura and it blocks the flow of CSF in that area. So your spinal fluid will get blocked off. When those tonsils are pushing, it'll block the fluid. So what's happening is it's not flowing through your spine. So you've interrupted the flow, right? So it'll get trapped in here and it'll just build because it's stuck. They're telling me I don't have anything stuck from my ectopia. They're telling me that there was no, I think it's called, they have a special name. They look like little white pockets on an MRI. You can see them like at the base of the neck. And they're telling me I don't have any of those. When I compared MRI images, I didn't really see them either. So apparently, I'm not blocked. So everything should be flowing. So their conclusion is that I must just not be reabsorbing. It's a long way of explaining why they don't think I'm blocked, but apparently the cerebellar ectopia is not blocking the flow of my cerebral spinal fluid. It's the fact that I'm not reabsorbing it, which would be something to do with my cavernous sinuses in my brain. There's also spots in your brain that excrete, make your spinal fluid. One of the surgeries they can do with hydrocephalus is they can actually go in and cauterize and close some of those areas so that your brain doesn't create as much spinal fluid. It's another option. I'm sure they do that like case by case basis. But
because it sounds like it's almost like you have a faucet on full blast going into like a bowl instead of a sink.
right.
It's just overflowing. It can't go anywhere. It has nowhere to go. It's like basically
Right.
a clogged sink. It's like you have a clogged sink. I know it's not
Yes.
blocked, but it's like they're saying it's not blocked, but basically just all this water is nowhere to go, so it's just overflowing.
Right. Yes. So it just keeps filling. The drain plug is in, right? And the tub keeps filling. And I don't have that catch built in that siphons it, sucks it out, right? I don't have the extra little thing on the tub that sucks the water out so the tub don't overflow.
Yeah, the
That's
little thing on a
broken.
sink where the little hole.
Yeah, I don't have the hole that siphons the water out so it don't overflow. That's missing or not working or something. But they can't tell me for sure, and they can't tell me why. And I feel like that should be something you should be able to see on a fucking MRI. And if not, then let's do another test so we can see it. We can figure it out. Let's refer me to a different doctor that knows more about this so that maybe they could understand what's going on. I'm not fucking around anymore. Like, you people are going to give me fucking answers, or I will beat down doctors' office doors until I find them. Like, that's where I'm at.
Did they do an MRI? Like, I think you said they did, but they do an MRI like when you were at the ER before they did the lumbar puncture?
No, well, so I had the MRI well before I went to the ER, and then they did what's called an MRV, which checks the flow of your spinal fluid through what's called your venous sinuses, which is where the spinal fluid goes. It's basically the big veins in your head that
So they did that
the
before
spinal
they
fluid
did the lumbar
travels through.
puncture?
Yes, yep. So
Did
they
they
wanted to
see anything
see
wrong with
if,
that?
well, they remarked that there was something that was one of my venous sinuses was very, very narrow, and you can even see it in the picture. Like, I have a picture of, actually have a picture somewhere that I could find, but
Okay.
didn't I send it to you?
No, you
I'm
didn't. You
pretty
just sent
sure
me
I
the
sent
Mayo
it to
Clinic.
you
Maybe, but
a while ago. When
a
I was in
while
the
ago
hospital, I thought I sent it to you.
when you're in the hospital, like the last time, or
Yeah, the last time.
like just like 2 days ago last time, or when I went up
No,
there
no,
last.
like, or the first time. I'm sorry, the first time. I
Oh,
thought I sent
then
it to you because I
you
took
might
my
have.
MRI and a normal one and put them next to each other, and you can see that vein looks like it's fucking missing. I'm
You might have. I don't remember. That was
just quickly
6 weeks
looking
ago,
through.
ma'am.
Yeah, I'm just quickly looking through our history of photos, but if I can't find it, I won't spend a lot of time on it. Yeah, I don't see it, but maybe I'll try to find it and maybe throw it in the Patreon or the Discord. But anyway, uh, basically, there is one of my sinuses. I think it's on the left-hand side. In the picture, it sort of looks like it's on the right, but that's because they're coming at my face this way. But it's looks like you're supposed to see it pretty evenly. So if you can imagine, like, here's the middle of my face, okay? There's like a tube right here, and then there's two that come out like this, and
It's like when you're wearing an
one on the
oxygen mask,
left-hand side.
oxygen
Do
thing.
what?
Almost like when you're wearing an oxygen lead.
Kind of, yeah. So that's kind of what the anatomy looks like. There's like one here, there's a bunch, but like the biggest ones you can see is like something here, and another one kind of comes off like this. And the one on this side is super fucking skinny and squiggly, and they're supposed to be pretty even. This side looks pretty good. This side's skinny and fucking squiggly.
Do you tend to get more
And they
pain
said
in
that
the
it was,
side of your face?
I get more pain in the left side. Yeah. So I get more issues on my left side. So they said that in the remarkings on the MRV, they said that that was most likely congenital, meaning I was born with it. Now, when someone sees congenital and then they see someone who's 34, they're like, oh, well, it's not bothered her until, up to this point, so it can't be that. Maybe it fucking is. Like, do you know what I mean? Like, I just feel like it's been glossed over. I feel like there's a lot of things that could be put together to a lot of little pieces of the puzzle that could be put together to paint a bigger picture, but it's been glossed over because nobody gives a fuck to look deeper and try to put the puzzle pieces together.
It's like you have 10 puzzle pieces and they're ignoring like 3 of them. They're like, well, we can't really put the whole puzzle together.
They're ignoring the majority of them. They're focusing on like 2 of them and they're fucking throwing out the other 8, essentially, is what they're doing.
And then wondering why they can't put the puzzle together.
Exactly. That's what's frustrating to me, is they're focused on 2 pieces and then they couldn't give a fuck about the rest of them. So, like, that's basically what's going on with me. I don't want to ramble too much longer about this, but like, so we're already like an hour and 40 minutes in, but I'm just at the point now where, yeah, we could. I'm just at the point now where I'm fucking frustrated. And I'm tired of doctors pretending they know my body better than I do just because they have a medical degree. I know what goes on in my own body. I know how I feel in my own body. And I need you to stop discounting that because of the things you can physically see about me. Because you're not going to physically see the things that are wrong with me.
Like what
you're not going to physically pick up on what's going on with me by looking at me, because my arm's not broken. My eyeball's not falling on my fucking skull. I'm not bleeding from the fucking ears. The problem is on the inside. The call is coming from inside the house, right? Like, you got to look deeper. You got to try harder. I am not, they say in the medical world, if you hear hooves behind you, it's most likely a horse, not a zebra. I'm the fucking zebra. I'm the zebra. Stop looking for the horse. The horse ain't there. This time it's a zebra, right? So I need you to start thinking outside the fucking box and focus on the fact that I am not a fucking horse. I am a zebra. And if you don't know how to handle a zebra and you need to call a wildlife vet, then call the fucking wildlife vet. But don't dick me around. Like, I have a fucking life I need to return to, and I'm tired of being fucking pushed away by these people and fucking invalidated by these people. This is why people die. Right here. This is why people die. Because they would rather be done, or they get pushed under the fucking push away and just told that everything's fine, and then all of a sudden they fucking croak over one day and of something that was fucking preventable. Because no one wanted to fucking listen to them. Especially fucking women. My God. And I'm a white woman too, so I don't even have the extra added layer of bullshit that like people of color or trans women or like all of this other shit that these people have to deal with, that I don't even have those fucking layers. And if I'm struggling this fucking bad, I don't even want to know what some of these other people have to fucking deal with. This is hell. And I don't want to keep doing this bullshit no more. Like, if you are out there struggling to get someone to fucking listen to you, I feel you. Like, this is the dumbest shit ever. This should not be this fucking hard. You should not have to push this fucking hard to get proper fucking medical care. And a person that fucking actually wants to take care of you instead of take your fucking money. It's stupid.
It's also like the whole time you're talking about like the doctors like it's like I'm like my mom friend override wants to be like, I will go with you to every appointment and make sure they fucking listen to you. It's like, I might not understand everything that's going on. Obviously, I don't feel what you're feeling. I don't know. I don't have medical knowledge, but it's like the whole, I've helped my mom like get out of like sleazy salesman pitches and everything, and where she almost got. I'm just like, no, I won't advocate for myself. But as soon as like my friend needs advocating or needs spoken up for, I'll be like, no, you fucking listen here.
Right.
That's where my anxiety goes away. It's like if someone else needs help, like having advocate, like that's, I don't know, like I don't remember what my the Myers-Briggs test. I think my Myers-Briggs test is being the advocate. So that's also like an autistic thing, like wanting justice for things. So it's like, So that's like I'm all about like I might not advocate, I might not speak up for myself when it comes to doctors, but it's like if someone's not being listened to, it's like no, I will be in there. And it's like
Right.
I have like a gun to their head, be like, no, you listen here, you motherfucker.
You listen here, motherfucker. Yeah. Like it's not okay. It's not okay to not listen to people. And like I'm about to start going shopping for doctors elsewhere. I actually did put in a request for someone at Barnes Jewish in St. Louis because I was able to
They
watch
have
a
a
little
really good system.
YouTube
That's where my
video.
dad
Yeah,
goes.
it's an amazing fucking hospital. It's an amazing hospital system and they have some of the best doctors there. So do they have those in Chicago too, but Chicago's a little
Loyola.
more of a trek for me than St. Louis. So I started at St. Louis and I found a neurosurgeon there that does specialize in every single thing that has ever been mentioned on any of my freaking MRIs or MRVs or anything that's ever been brought up. He specializes in all of it. So, and he had a little video about what his philosophy was, and I just got a really good vibe from him. So I put in a request for an appointment call. And so I'm waiting to hear back to see if I can get in with him because I mean, in the meantime, I'm happy to like be referred to whoever here, but if they think I'm just gonna roll with the first fucking neurosurgeon that they refer me to, they're wrong. Like if you're gonna get in my brain, I'm gonna vet your ass first. Like I want to make sure that you're not some fucking crazy person. I gotta come back from this, you know? Like I, I don't know. Just I'm just so frustrated. And I told her I don't think I've ever been this soul crushingly sad and defeated before in my entire life. It's a lot. I'm dealing with a lot. And I just want answers. I just want to know why at this point. I want to know why so that at least I have something to attribute all of this to, right? That is the hardest part is not having a concrete diagnosis of this is why this is happening to you. And it's really difficult. That's all I can say.
Basically, you're
But
sick and tired of being sick and tired.
exactly. Okay. Well, folks, I think that's it.
That's all we got.
What do you think? That's all we
Yeah.
got. Yeah. So we don't know what's going on. I hope maybe it'll fix itself. But on my side, Amanda looks kind of grainy in her video for Patreon people. So if that comes up for you, sorry. But
I look fine, so I think she's just going crazy.
That might be it. Who knows? Anyway, we're gonna get to the end here. We're gonna wrap it up. Thank you for sticking around for 2 parts of this at this point.
Mm-hmm.
Didn't really intend to make it 2 parts. It just sort of happened that way.
We just kind of fell into it.
Yeah, but it's fine. Everything's fine. All right, let's we don't really have a transition this time, but I will hit you with the
Julie, do the thing.
I'm afraid there are no more things to do.
So it's time for the fun and fuckery portion of today's episode. There we go. There's our little fun and fuckery. Here we go.
Ba-da-bum.
Ah, yep. Okay, we'll find something. Maybe I'll make a little animation we can do, change it up a little bit. But for now, this is what you get. All right, here we go. I have words for you, ma'am.
Okay. I am ready.
Okay.
And you did Secret Santa?
Yeah.
Okay, just making sure. I need from you a noun.
Postwoman.
Postwoman. Post haste. Okay.
Post haste.
Part of the body.
Kidneys. Because mine was hurting earlier.
Kidney. Adjective.
Sparkly like my Crocs I bought earlier today.
Sparkly like my Crocs I bought earlier.
No, you don't have to write the whole thing. Just sparkly.
I would, don't test me. Noun.
Newspaper.
Newspaper. If anyone gets that reference, we love you. Bye.
Fire.
Adjective.
Enchanting.
Enchanting. Part of the body.
Vulva.
Yeah. I just don't like that word. It's just like the word just like it. One of those words. That's like my moist, you know?
Yeah.
Verb.
Exfoliate.
Exfoliate. Expecto patronum.
Patronum.
Noun.
Fire.
Fire. Blood. Adjective.
Creamy.
Creamy goodness. Plural noun.
Pancakes.
Pancake. Noun.
Drain pipe.
Shut up your drain pipe. Okay. Adjective.
Autistic. We've never done that before.
Adjective.
Yappy. Like that's a yappy dog.
Can I pet that dog? Can I pet that dog?
Can I pet that dog?
I love that video. Part of the body.
Brain.
Brain.
Since I just spent the last 2 hours bitching about it.
Verb.
Schlep.
Schlep. Verb.
Fumble.
This kind of makes sense. Plural noun. That's it.
Bunt cakes.
Bunt cakes.
Talk to me. What do we got?
Okay. It's called Secret Santa. Still doing our adult Mad Lib.
Okay.
Okay. Buying Christmas presents for every family postwoman is not only stressful, but also costs an arm and a kidney. Which is why it makes sense, like black market shit. Which is why doing Secret Santa can seem like a sparkly option. That way, everyone picks a newspaper from a hat and buys that person a gift. Simple, right? But be warned, enchanting Santa can really vulva fire. Yeah, it sounds like an STD. can really vulva fire. What is that supposed to be? Can really, like, if
like
what
backfire.
Backfire. I'm like, what word would they be looking for? Santa can really vulva fire if, like most of us, you like to re-exfoliate presents from previous years. There's nothing wrong with recycling that useless fire maker your aunt got you, or the creamy edition plate set of the U.S. pancakes that Grandpa thought was right up your drain pipe. When I said show me your drain pipe, it's not because I read part of what that said. I just
oh shit.
Unless you end up wrapping that present like it's brand autistic and giving it to the person who originally gave it to you. Whoops. What just happened? You must have absolutely tell a big yappy lie that your brain picked the gift just for them. They may not believe a word you schlep, but you really don't have a choice. To avoid a scenario, make sure you fumble down who gave you what unwanted item. As long as you keep track of them, bad bunt cakes are the gift that you keep giving to someone else.
Oh my god. I don't think there's a such thing as a bad bunt cake, okay?
I guess if you make it wrong, but you know.
That's true. That's true. Okay. Well, that's it. This concludes our 2-part series.
Which is
of our comeback code.
If we really didn't mean to make it a 2-part series, but
we really didn't.
So it was
like
I
talk a lot, clearly.
It was like a hasty decision.
Yeah. So we're not going to talk at you any longer. Thank you for sticking around. Thank you for being patient with us. Thank you for just hanging in there during our break and all the things. And we will see you next week.
Yeah, we love you.
Okay, bye.
Okay, bye.